Welcome to the Life After a Heart Attack or Heart Surgery podcast. This show delivers actionable strategies regarding heart health wellness, helps rebuild your confidence and manage health anxiety. Sally provides practical wellness tools for life after your event or diagnosis. If you want to learn how to move past the fear of what if and manage your energy so that you can live a full, happy life again, you're in the right place. And now your host, Sally Crawley.
Hello, my beautiful friend, and welcome to this reassuring and calming session. Today's relaxamation is based on the affirmation, I am allowed to cry. If you don't know what a relaxamation is, it's a combination of a guided meditation with mindfulness and an affirmation included. To find out more, then please read my blog or listen to episode 22 called Relaxamations Explained. The Big Calm and the Feel Good Factor. I'll link to it in the show notes and the blog post. After a heart attack, heart surgery, implantable device, cardiac arrest, a diagnosis of heart failure or any other cardiac event, people often expect the focus to be on the physical recovery. Your medications, appointments, your blood pressure and activity levels, your wound healing and your heart. But what about everything that has happened emotionally? What about the shock, the fear, the sadness? What about the loss of the life that you thought you had before your cardiac event? Even when your treatment has gone well, you may still feel, though, something has been taken away from you. You may feel like you're grieving your old sense of safety. You may be grieving your independence, your confidence, or the person that you felt you were before. And you may be grieving plans that have changed, activities that you cannot yet return to, or the future you once imagined without having to think about your heart. You may even find that you're grieving the simple ability to go through your day without wondering what every sensation in your body means. That's an awful lot to carry, and sometimes that sadness comes out through tears. You may find yourself crying over something that seems quite small. A song on the radio, a hospital letter arriving, someone asking whether you're all right, or even looking at your scar and seeing old photographs, watching other people getting on with their lives. Or you may cry for no reason that you can easily explain. I can remember sitting at home after my heart attack, with my leg in plaster and unable to look after myself properly, crying and feeling completely lost. Sometimes the tears came without warning. At the time, I didn't necessarily understand everything that I was feeling. I just knew that life did not feel the same. Perhaps you've experienced something similar. You may have been told how lucky you are. You may have been encouraged to stay positive, be grateful, or look on the bright side. But of course, you may feel grateful, and you may feel incredibly lucky to be here like I do. But gratitude does not cancel out grief. Relief does not cancel out fear. Hope does not mean you're never allowed to feel sad. You can be thankful that you survived and still be upset by what happened. And you can still be making progress and yet still have very difficult days. You can be strong and still cry, because crying is not a sign that you are failing in your recovery. It's not proof that you are weak, and it does not mean that you are going backwards. Tears can be one of those ways that your mind and body release some of those emotional pressures that you've been holding inside. And you don't need to apologise for them. You don't need to explain them. And you do not need to stop them simply because someone else feels uncomfortable. Today, I want to give you permission to feel whatever you are feeling. You do not have to force yourself to cry during this relaxation, as there's no right response. You may cry. You may feel emotional without tears. You may feel calm. You might even feel numb, or just simply enjoy the opportunity to rest. Whatever happens, it's perfectly all right. The purpose of this relaxamation is to help you treat yourself with greater gentleness and compassion, to remind you that your feelings are part of your healing, and to help you begin to believe, I am allowed to cry. So just before we begin, I also want to say something really important. Feeling sad, low or tearful can just be part of adjusting after a cardiac event. However, you don't have to cope with persistent or overwhelming sadness on your own. Please speak to your GP, doctor, cardiac rehabilitation team, or another healthcare professional if your low mood continues, if it interferes with your everyday life, or leaves you feeling hopeless. And if you are having thoughts about harming yourself or not wanting to be here, please seek urgent help. Asking for help is not weakness either. It's another way of taking care of yourself. And now my safety notice. As we're going to move into the relaxation part of this episode, please do not listen to this section while driving, operating machinery, exercising, or doing anything that requires your full attention. Choose a safe, quiet place where you can sit or lie down comfortably and remain undisturbed for a little while. Take a moment to make sure your body is well supported. You may wish to have a blanket nearby and perhaps a tissue too. Not because you have to cry, simply because you're making room for whatever you need. And when you are ready, allow your eyes to gently close. Or soften your gaze if keeping your eyes open feels more comfortable for you. You may want to just look down at the floor in front of you. Begin by noticing the support beneath your body. Notice the chair, the bed, or the surface beneath you. You don't have to hold yourself up quite so much now. Let yourself be supported. Take a comfortable breath in. There's no need to take a particularly deep breath. Just breathe in a way that feels easy for your body today. And then when you're ready, allow the breath to leave you slowly and naturally. Breathing in and gently breathing out. As you breathe out, imagine letting go of just a little bit of the effort you've been making. You don't need to solve anything right now. You do not need to make any decisions. You do not need to pretend that you're all right. For these few moments, you can simply be here. Now, in your imagination, picture yourself in a place where you feel safe and protected. You may imagine a warm, comfortable room. There's a soft chair waiting for you, a blanket, perhaps a warm drink nearby. And through the window you can see a gentle rain beginning to fall. You are warm and dry inside, safe within this quiet shelter. You can watch the raindrops travel slowly down the window. There is no rush. Each drop follows its own path. Some move quickly, some pause. Some join with another drop before continuing, and some remain still for a while. There is no correct way for the rain to fall, just as there is no correct way for you to feel. Outside, the earth receives the rain without judgment. The ground does not tell the rain that it's being too emotional. The flowers do not ask it to stop. The trees do not apologize for needing water. The rain is simply allowed to fall. And perhaps you can begin to offer yourself that same acceptance. You are allowed to feel. You are allowed to be affected by what has happened to you. You are allowed to acknowledge that recovery can be difficult. You are allowed to miss the person you were before. You are allowed to feel angry that this happened. You are allowed to feel frightened. You are allowed to feel disappointed, frustrated, tired, or sad. And you are allowed to cry. If tears come now, you can let them come. There is no need to hold them back. And if no tears come, that is all right too. You're not doing anything wrong. Sometimes feelings arrive as tears. Sometimes they arrive as silence. Sometimes as tiredness. Sometimes as a tight throat, a heavy feeling, or a need to be still. However your feelings appear today, you can meet them gently. Now silently repeat these words in your mind. I am allowed to cry. Once again, I am allowed to cry. And again, I am allowed to cry. Notice how those words feel. You do not have to force yourself to believe them completely. Just allow the possibility that they may be true. I am allowed to cry. My tears are not weakness. My feelings are part of my healing. You may have spent much of your life trying to be the strong one, the reliable one, the person who copes, the person who looks after everybody else. Perhaps you learned that crying was embarrassing, that tears should be hidden, that you should pull yourself together, that you should not make a fuss. But strength is not the absence of emotion. Real strength can include honesty, vulnerability, asking for help, saying, I am struggling today, allowing someone to sit beside you. Letting another person see that you are human. Your tears do not erase your strengths. They exist alongside it. You can be brave and frightened, grateful and sad, hopeful and uncertain, strong and tearful. There is room within you for more than one feeling at a time. And again, I want you to silently repeat in your mind the following phrase. I can be strong and still cry. Again, I can be strong and still cry. And once more, I can be strong and still cry. Crying does not always need to be analysed. You do not have to find a perfect explanation for every tear. Sometimes you simply need to let the feelings move through you. At other times, your sadness may be trying to show you that something needs your attention. Perhaps you need more rest. Perhaps you need reassurance. Perhaps you need to talk about what happened. Perhaps you need someone to listen without trying to fix you. Perhaps you need practical help. Perhaps you need to set a boundary. Perhaps you need to grieve something that has changed. Perhaps you need to be kinder to yourself. Imagine now that you are sitting beside the version of you who has been through your cardiac event. See that person as they were during the most difficult moments. Perhaps frightened, confused, exhausted, in pain, or trying very hard to be brave. You do not need to relive what happened. You are simply observing this version of yourself from a very safe distance. What would you like to say to them? Would you tell them to stop crying? Would you tell them that they were weak? Would you tell them to hurry up and get over it? Or would you speak gently? Perhaps you would say, "You have been through so much. It's all right to feel upset. You do not have to pretend with me. I am here. You are not alone. Take all the time you need." Now imagine offering those same words to yourself today. You have been through so much. It's all right to feel upset. You do not have to pretend. You are not alone. Take the time you need. Let those words settle gently within you. Sometimes tears allow other people to see that we need care. They can open a door to connection. You are still in control of who you share your feelings with. You do not have to be vulnerable with everyone. But perhaps there is one person who feels safe someone who can listen, someone who can sit quietly beside you, someone who does not need to offer advice or find a solution. Imagine allowing that person to support you. Perhaps you say, "I don't need you to fix anything. I just need you to be here." Notice how it feels to imagine receiving that support. You are worthy of care. You are worthy of comfort. You are allowed to need other people. Accepting help does not make you a burden. It allows the people who care about you to show that they care. Now silently in your mind repeat the following words. I allow myself to receive comfort and support. Again, I allow myself to receive comfort and support. And once more, I allow myself to receive comfort and support. Now return your attention to the gentle rain outside the window. Perhaps it is still falling. Perhaps it has begun to slow. There is no need to decide when the rain should stop. It will find its own natural ending, and the same can be true of tears. When you find an appropriate and safe place to cry, you can let the tears come for as long as they need to. And afterwards, you do not have to leap up and solve your whole life. You can pause, take a drink of water, wash your face, wrap yourself in a blanket, rest, and speak to somebody. Or maybe ask yourself one simple question. What do I need now? Not what should I be doing? Not what would everybody else expect? Simply, what do I need now? Perhaps the answer will be rest, perhaps company, or maybe just quiet. Perhaps fresh air, perhaps medical or emotional support, or perhaps just one small practical action. Whatever the answer, you can listen with compassion. Crying does not mean becoming trapped in sadness. It can be part of allowing sadness to move. A feeling can be acknowledged without becoming your whole identity. You are experiencing sadness. You are not sadness itself. You are experiencing grief. You are not only your grief. You are a whole person moving through a difficult chapter. A chapter that deserves patience. A chapter that deserves care. A chapter that does not have to be rushed. Now in your mind, again, repeat the affirmation 5 times, slowly and gently. I am allowed to cry. 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 And allow these additional words to settle within you. My feelings are welcome. My tears are not weakness. I treat myself gently. I listen to what I need. I accept support from people I trust. I can feel deeply and still move forward. I am healing in my own time and in my own way. And you may like to imagine these words being absorbed into every part of you, not as instructions, not as demands, but as permission. Permission to be human. Permission to feel. Permission to heal. And as you can, imagine yourself now moving through the coming days. Perhaps there is a moment when emotions begin to rise. A lump in your throat, tears prickling behind your eyes, a heaviness in your chest that you recognise as sadness. Instead of immediately pushing the feeling away, imagine pausing, taking one comfortable breath and saying to yourself, I am allowed to cry. You find somewhere that feels safe and you give yourself time. You allow the feeling to be there without judging it. You may cry, you may not. Either response is acceptable. And when you are ready, you ask yourself, what do I need now? Each time you respond to yourself with compassion, you strengthen a new pattern. A pattern of listening rather than criticizing, allowing rather than suppressing, caring rather than judging. You are learning that your feelings do not have to frighten you. They can rise, they can be felt, and they can change, like rain passing through the landscape. And it's now time to bring this relaxation to a close. Know that you can return to the affirmation whenever you need to. I am allowed to cry. Begin by noticing the surface beneath your body once again. Notice the room around you, the temperature of the air, any sounds nearby. and take a comfortable breath in and let it go. That's right. You can begin to bring your attention back to your body, perhaps moving your fingers and toes, allowing yourself to move, and perhaps your mind is becoming clearer now as your body becomes more alert, and opening your eyes when you feel ready. That's right. And remember, take your time before standing or moving on with your day. You don't always have to be all right. Your tears are not evidence of weakness. They are evidence that you are human. So be gentle with yourself. You deserve the same patience, compassion, and understanding that you would offer to someone you love. So, hope you're feeling bright and shiny now. So just to remind you, I want you to use, if you like, today's affirmations. I want you to say them 5 times as a set and repeat the set at least twice a day. You might connect them to something you're already doing each day, like in the morning when cleaning your teeth and last thing at night, maybe while you're getting dressed or making a drink, or perhaps when you're settled down in bed. And as a reminder, here we go. Your affirmations are: I am allowed to cry. My feelings are part of my healing. And I can feel deeply and still move on. And if you'd like to take this further, I suggest that you pop over to my website, which is www.myheartandmind.co.uk/podcast, or just scroll down to the show notes and you'll find some self-reflection and journaling prompts to help you on your way. So it just leaves me now to wish you a wonderful evening or a wonderful day, and I look forward to speaking to you again soon. Until next time, bye-bye.
As we close today's episode, a quick but important reminder. This podcast is intended to support and complement your medical care, not replace it. Sally is not providing therapy, medical advice, diagnosis, or treatment. If you have concerns about your heart, your health, or any symptoms you're experiencing, please seek advice from your GP, cardiologist, or emergency services immediately. Always listen to your body and always follow the guidance of your healthcare team. To get more from Sally, visit www.myheartandmind.co.uk.